First, this is definition what has been given by NICE. They say that long COVID is defined as signs and symptoms developed during or following a disease consistent with COVID-19 and which continue for more than 4 weeks, but they're not explained by alternative diagnosis. Yes, this is very more important. So there is always different societies or bodies have given different definitions, but to understand, they have considered symptoms which has started or which continued even after 4 weeks after the starting of COVID-19 is considered as our long COVID or post COVID. Actually, there is a very good article in Nature Medicine. They have clearly, they in fact, to break down this confusion, they have much more, categorized into something less than 4 weeks, something more than 4 weeks to 12 weeks, and something, the other category is something beyond 12 weeks. So, because there are almost four journal publications mentioning that it's around 50 to 87% of the people, in spite of RT-PCR negative after their first COVID infection, they still had their symptoms. Varied symptoms. It need not be that patients getting admitted to the hospital or they're sick, their oxygen saturations are low. Even though they got discharged from the hospital, they still continue to have mild symptoms of different variations of different categories or levels. So that is what we are going to talk about. So initially, to talk about a definition as simple as that, any symptoms which are persisting or newly occurring symptoms after 4 weeks after your first symptom or first RT-PCR positive report of COVID can be considered as post-COVID or long COVID, where there is no other explained alternative diagnosis. So next one. So incidence, as this is what I was quoting about the paper in Nature Medicine. So the incidence of post-COVID sequelae in those who have tested positive and who have been managed in an outpatient setting or in the home is estimated between 10 and 35%. However, for those who are hospitalized, the incidence of post-COVID syndrome may be nearly 80%. So it is anywhere between 35 to 80%. This is quoted by one esteemed journal. And there are few other journals which they mention it's around between 50 to 87%, even after 60 days to 3 months. So these are the other thing. So one is 10 to 35% for in non-hospitalized or home quarantine patients, while for hospitalized patients it's almost around 85%. The other thing quotes that they have noticed the incidence is around 58.2% and 36.6% and 37% in severe, mild, and patients who has symptoms without any pneumonia respectively. This is one more. So if you see that huge vast difference, all the more what we can understand from that is it's not just COVID. We have a biggest challenge coming around. It's post-COVID. So everyone has to be aware of this, and everyone have to always keep their patients to be followed up if any symptoms they have. So I'll be enumerating what kind of symptoms, what kind of complaints the patients usually approach to the outpatient, where we have to delineate from other systems and contribute it to the COVID. So as this is what I was talking about, the classification of post-COVID-19. So they have divided into 4 groups, that is subacute or ongoing symptomatic COVID-19, which includes symptoms and abnormalities present from 4 to 12 weeks beyond acute COVID-19. So we consider acute COVID-19 till 4 weeks. Beyond 4 weeks till 12 weeks, we consider subacute or ongoing symptomatic. Now, after 12 weeks, we consider it to be chronic or post COVID 19. So, but the trick here is uh, it's not attributable to any other alternative diagnosis. So, we should make sure that any symptoms the patient is coming up with, we need to rule out all other possible provisional diagnosis. And in fact, simply speaking, post COVID is the last thing which we have to claim, at the same time the first thing which we have to suspect.